Have you ever went to the doctor and about 2 weeks to maybe 3 months later, you get a piece of mail from your insurance company that says, "This is not a bill," right on it. And you probably, if you're like I used to be, you just toss it, never think about it again. Well, that's your explanation of benefits or your EOB. And you shouldn't toss it, because in this episode, I'm explaining what they are and why it's important. Hi, my name is John. I'm your healthcare hacker and a hoarder of EOBs. Before we start talking about explanation of benefits, please take a moment and like our video and subscribe to our channel so you can keep up to date with the latest healthcare hacks and ways to navigate the complex US healthcare system. So, explanation of benefits. Why should you keep them? Well, let's first start talking about what they are. And then we'll go into why you need to keep them. Unfortunately, every health plan has a slightly different version of an explanation of benefits. So I can't say definitively, here's what your EOB will contain. It really varies depending on what type of insurance you have. But there are a couple common features, common columns that every EOB has that you need to know so you can understand what you're going to have to pay for healthcare. The first field that every EOB has is something called charges. This is the rack rate that the hospital or doctor is charging the insurance company for the service you received. Now, that's what everyone pays. That charges, if you have a CT scan, doesn't matter what insurance you have, or even if you have insurance, they're going to be the same amount. The second field is something called allowed amount. This is the amount the insurance company has contractually agreed to pay to the provider for that service. So it's after a discount. Almost every insurance company, if it's going to an in-network provider, has arranged a discount below charges that you have to pay and they have to pay for the service. Then there's a group of fields that are most important to you. These are your financial responsibilities. There's usually a separate box around them that highlights them on your EOB, but it'll say things like deductible, co-insurance, co-payment, and maybe non-covered services. If any amount in those four fields are going to be things that you are going to have to pay the provider. So these are really important fields. At the end of the day, these are what you're going to get a bill for. Often there's comment fields. These are when something goes wrong or there's some explanation that the insurance company is providing you of why they're not paying the full amount. Now, some of these can be simple as, hey, per our contract allowance, this is what we're going to pay. Some of them could be, this is denied service, or you're responsible for this amount unless you sign something. So you really need to pay close attention, especially if what you're being asked to pay is more than you expect, because those can help you understand why you may be in that situation. I wanted to explain explanation of benefits to you today so that you had an understanding of what they are, because we're going to be using those in the next coming episodes around how to catch errors, because the explanation of benefit is a very important tool in order to catch an error and make sure you're not paying for something you shouldn't. So you need to keep them. Now, do you need to keep stacks of paper? Not necessarily. As long as you have access to them electronically, that's absolutely fine. You just want to be able to refer back to them at a future date. So if you have any questions about explanation of benefits or any other financial topic around healthcare, please leave them in the comments below, and we'll try to address them in a future episode of Healthcare Hacks. And as always, make sure you get the facts by joining me on the next episode of Healthcare Hacks.